Module will help you keep the proper perspective as you move forward in your healing journey, like what to expect during the healing process, how to identify the best therapies, the benefits and risks of conventional tests, and safer alternatives, plus how to interpret your test results, blood markers you should be watching, and monitoring tests that you can order without a doctor. So let's start with the healing process. One thing you need to understand is that healing happens in phases, and everyone is different. So some cancer patients heal very quickly, some take a little longer, some take years to get well. So you need to have realistic expectations, and that is, we don't know how long it's going to take. You are different than me and different than every other cancer patient, so it's important to keep that in mind. There may be some trial and error involved, so you need to be methodical with your approach. Some therapies work for some people and don't work for others, but the only way to know if what you're doing is working is to monitor your progress. You can't just do a whole bunch of therapies and try a bunch of diets and take a bunch of supplements and then let months or years go by and hope for the best. I know you may be afraid to get tested because it might be bad news, but you need to do it. You have to face down your fear, and you need routine testing to make sure that what you're doing is working, because if it's not working, you'll need to make some changes. The sooner you know if something isn't working, the sooner you can try a different approach. I believe that what I've outlined for you in this course is the absolute best first approach for you to radically change your life and support your body's ability to heal. That's why it's called Square One. Now, there are certainly other options available to you if you don't get the results you want. You can go to a clinic in Mexico or Germany or Switzerland or wherever, but I think this is the best possible starting point because you have to change your life first. The next thing you need to know is that healing happens in phases. There are ups and downs in the process. You may feel great for a while, and then you may have a few days or a few weeks where you feel terrible. And you might think, like, oh no, am I getting worse? You might have some aches and pains. And of course, when you have cancer, you think every ache and pain is more cancer. Relax. It's probably not. I've had lots of aches and pains come and go in the last 13 years, and none of them were cancer. But anyway, health doesn't improve in a straight line. If you've ever looked at financial reporting, when a stock rises in value over time, it doesn't go up in a straight line. It goes up a little, and then it goes down a little, and then it goes up a little more, and then it goes down a little more, and then it goes up again. It's trending up over time, but there are small setbacks along the way. The healing process is the same way. You'll get better and feel great for a while, and then you may have a little setback, and then you feel great again, and then you have another setback. Your body is working things out. It's repairing, it's regenerating, it's detoxifying. Trillions of chemical reactions are happening every day, and it's doing things that we don't even understand. But the point is, sometimes you have to get worse before you can get better. If you've ever been sick with a virus, you know that your body runs a fever and you feel terrible. But that fever is actually a good thing. That's your body ramping up your immune system, waging full assault on the virus to destroy it. The fever makes you feel bad, but it's part of the healing process. By the way, if you do get sick and run a fever, it could be a great thing. Your body could be ramping up your immune system and destroying cancer cells along with viruses, bacteria, and other pathogens. Bad things in life often turn into good things. Believe that. Okay, so healing happens in phases, and you've got to be methodical, and you need to monitor your progress. Now let's talk about the different scenarios you can expect as a cancer patient. Best case scenario number one is you adopt the radical life-changing principles I've laid out in Square One. You give it 100%, and in 90 days, you get your blood work or a scan. And you find out that your cancer markers are down and the tumor is shrunk, or you have multiple tumors and some of them are gone, or all of them are gone. That's the best case. Your body responds and heals quickly. If that happens, don't go back to your old way of life. You need to stay on this program for at least a couple years because it takes a few years to completely rebuild and create a new, healthy, quote-unquote, cancer-proof body. So if you start getting good results right away, don't slack off because you're still in the danger zone, and cancer can easily bounce back if you let down your guard in the first phase of healing. Don't make that mistake. Sometimes a patient will adopt a hardcore nutritional protocol, natural therapies, herbs, supplements, whatever, and after a few months they feel better, their symptoms reduce, the pain goes away, tumor starts shrinking, and then for some reason they let their doctor talk them into treatment. It's a strange phenomenon, but I've seen it many times. The natural strategy's working, but then they get impatient or the fear takes over and their doctor says, well, now that your tumor shrunk, this would be a great time to have surgery or start chemo or do some radiation, all of which carry numerous risks, including making cancer stem cells more aggressive and promoting metastasis. If you're shrinking a tumor with nutrition, you don't need any conventional therapies. Just keep going. So the best case scenario is that it starts shrinking or it goes away quickly. If that happens, stay the course. Best case scenario number 2 is that there's no change. Let's say you start this protocol and after 90 days you get blood work or a scan and there's no change. It's not uncommon for cancer doctors to spin this as bad news. If your doctor knows you're doing alternative therapies, they might say, see, what you're doing isn't working, the tumor's still there, your cancer markers haven't changed, you need chemo, or whatever. No change means it stopped growing. That's good. Don't let them put a negative spin on that and try to scare you into treatment. A tumor has to stop growing before it can shrink. You have to stop it first. The body prioritizes healing. That means when you adopt a radical diet and lifestyle change, your body may heal other things first. It may be healing your liver, your kidneys, your lungs, your thyroid. The tumor is on the to-do list, but it hasn't gotten to it yet. That's okay. If your tumor stops growing, that is very good news. And hey, it may never shrink. You may have to live with the tumor for the rest of your life, but that's okay, right? If it stops growing, it can't take over your body, and it can't kill you. It may go dormant, or it may die and become scar tissue. If you have a non-growing tumor in your body, you can live with it forever, right? Best case scenario number 3 is it slows down. Remember, it's got to slow down first, then it can stop, then it shrinks. If the rate at which it's growing slows down, that means you've bought yourself some more time. That means what you're doing is working to some degree. You may not have it dialed in exactly right. You may need to try some new things, make some modifications, tweak your protocol, but that is still positive news. Slowing a tumor down is a good thing. And the only way to know if it's slowing down is to look at how much it's growing between incremental periods of time. Usually your doctor can tell, but again, you can't trust them completely because they tend to be biased against nutrition and natural therapies. And they may try to spin the test results to make it look like what you're doing isn't working, when in fact it may be. So if it slows down, that's good. Gotta slow it down first before you can stop it. 4th scenario, your tumor keeps growing at the same rate. If the cancer markers in your blood continue to rise and your tumor is growing, then what you're doing may not be working, and you may need to consider a different strategy. I met a woman last year who healed breast cancer with nutrition and natural therapies, and she told me that in the beginning, her tumor got bigger and more painful, which I'm sure was concerning. I mean, that would be really scary. But she stayed the course, and then around month 5, it started shrinking. And by the end of the year, it was gone. Like I said, sometimes you have to get worse before you can get better. Before we get into specific tests, I've got one more thing for you to think about. The days and weeks leading up to a new test can produce a lot of anxiety. We call it scanxiety. Stress and anxiety suppress your immune system, and if testing and scans is causing you a lot of anxiety, space them out further. I think testing and monitoring is important, but I also know patients who despised being conventional medical patients. So much so that they decided never to go back to the doctor, and they got well. This is your life. You don't have to do anything you don't want to do. Okay, now let's talk about specific tests. It's a good idea to get a test done right at the beginning of starting a new protocol to establish your baseline. If you've had testing done within a month, that's okay. Just keep in mind that a test is just a snapshot. It's not the whole story. And snapshots can be misleading, especially blood work. You can have crazy looking blood work one day and normal the next. So you have to compare tests over time to understand what's happening in your body. The first test on the list is the RCGG Onconomics Plus test. It used to be called the Oncostat test, and it's also known as the chemosensity test or the Greek test. In this test, they take your blood and separate out the circulating tumor cells, and then they test a bunch of drugs and natural compounds against those tumor cells to see what makes them stop growing or die. They test about 100 different drugs, chemo drugs, and targeted therapy drugs, and they can tell you if drugs like cisplatin or 5-FU will have any effect before you let your oncologist put them in your body. If you're considering chemo, wouldn't it be nice to know if your cancer responds to the drugs they want to give you? The Grease test will give you a much better indication of whether or not chemo drugs will have any effect. They also test 45 natural compounds against your cancer, like vitamin C, Laetrile, Endo-3-carbinol, and mistletoe, so you can see which natural therapies might be effective against your type of cancer. And there's genetic testing involved as well. Basically, it's going to help you identify which therapies, conventional or alternative, and which nutraceutical compounds may be most effective against your type of cancer. And you can find that out before you spend any money on treatments that may not help you. Unfortunately, most oncologists don't use the Grease test, and it's not covered by insurance. But I think it's a worthwhile investment, and you get the results back in about 10 days. The website is rgcc-group.com. Next is MammaPrint. This is a genetic test for early-stage breast cancer patients with 0 to 3 positive nodes. And it calculates the risk of recurrence and whether or not a patient will even benefit from chemotherapy. In the MIND-ACT Phase 3 clinical trial, the MammaPrint test reduced chemotherapy prescriptions by 46% among more than 3,300 patients in the trial. This groundbreaking test basically proved that nearly half of early-stage breast cancer patients don't need chemo. And the good news is the MammaPrint test is covered by Medicare and most insurance companies. There's a similar test called the Oncotype DX, but it has not been proven in a Phase 3 clinical trial, so go with the